Welcome, everyone. We're really thrilled to be bringing you this webinar. At CDPAC, we recognize the importance of food and food environments and how they support healthy living and disease prevention. And so we're really pleased to be working with Health Canada and today's presenters to really help support increased awareness and uptake of tools and resources like the Food Retail Environment Assessment Manual that you're going to be learning about. It's a real privilege for me to present Dr. Hassan Hutchinson, Director General of Health Canada, the Office of Nutrition Policy and Promotion, and to provide, who's going to provide welcome remarks and explain some background and rationale for the work you'll be hearing about during today's webinar. So without further ado, I'll turn it over to you, Hassan.
Thanks very much. It's really a great pleasure to be here today. I am extremely thrilled to be part of this work. The interest, momentum, and action with respect to improving food environments across Canada has really never been higher. It's truly an exciting time. We know that the environments in which people live, work, and play have an important role in determining their health, including obesity and dietary patterns. Food environments specifically are increasingly recognized as important determinants of population nutrition and health. We also know that the current food environment makes it very challenging for Canadians to choose nutritious foods, even when they know they should. As the federal lead for public health nutrition in Canada, our office is responsible for advancing the nutrition policy priorities in the Curbing Childhood Obesity Framework. One of the priorities of these framework is to look at ways to increase the availability and accessibility of nutritious food. A comprehensive, multifaceted approach, which includes a range of actions, is needed to effectively increase access to and availability of nutritious foods. Over the past several years, my office has worked to improve food environments. In 2011, we surveyed our federal, provincial, and territorial group on nutrition-determined needs. The food retail environment is identified as a very strong priority. At the same time, grocers associations were increasingly expressing interest in working collaboratively with governments to promote and support healthy eating. This led to the development of two reports: Working with Grocers to Support Healthy Eating and Measuring the Food Environment in Canada. The reports responded to the growing interest among federal, provincial, territorial governments and stakeholders to understand how the food environment, a key determinant of food consumption, could promote and support healthy eating. Following the release of the Measuring the Food Environment in Canada report, our office again consulted stakeholders, including the federal, provincial, territorial group on nutrition, to assess gaps and determine needs. What emerged was a need for capacity building at the local level in assessing food environments, and further, the need for a user-friendly manual to help assess food environments in local communities. The 5 provinces and territories, the Public Health Agency of Canada, the Chronic Disease Prevention Alliance of Canada, and the Canadian Institutes of Health Research joined in a working group with us to advance the work on improving food environments. In July 2014, Dr. Leia Minaker, a Canadian health environment researcher and author of the Measuring the Food Environment in Canada report, joined Health Canada to help advance several food environment initiatives, including the development of the Food Environment Manual. Leia facilitated extensive consultations with stakeholders, including practitioners, academics, and policymakers, to inform the development of the manual. She has presented over the last year at a number of different conferences and food environment events to gather further input, including the 2015 Canadian Obesity Summit, the Food Environments in Canada Symposium and Workshop that was in Saskatchewan, I believe, last spring, public health meetings out in Vancouver, and most recently at the 2016 CDPAC conference. The manual is intended to provide comprehensive and consistent food environment assessment tools that can be adapted and used in any community across Canada. It's designed to encourage multi-sectoral engagement, both in the assessment phase and in the knowledge dissemination and decision-making phase. It will be tested across Canada, including in communities as part of the CIHR-funded research project FRESHIT, which stands for Food Retail Environments Shaping Health Intervention Toolkit. You'll hear more about the FRESHIT initiative throughout this webinar series. Health Canada is pleased to be a knowledge user for this initiative. Events such as this one provide an important forum where people can share information and discuss new ways of measuring the food environment. Thank you again for inviting me to join you today and for hosting such an important and timely event. Look forward to hearing about the outcomes of the discussions.
Thanks very much, Hassan. It's now my pleasure to introduce our co-moderator for today, Lisa Moani, who is a policy analyst with Health Canada's Office of Nutrition Policy and Promotion. Lisa is going to be introducing today's presenters and will be chairing questions and discussion with our presenter. For those who are just joining, my name is Bill Callery. I'm with the Chronic Disease Prevention Alliance of Canada, and I'll be co-moderating with Lisa. We'll be taking questions throughout the webinar on the chat box, so you can enter any questions you've got there, and we'll be addressing questions at the end of the webinar. Over to you, Lisa.
Great. Thanks very much, Bill. It's my pleasure to introduce both Dr. Leia Minaker and Dr. Catherine Mah. Leia Minaker is a scientist at the Propel Center for Population Health Impact at the University of Waterloo. Her research interests are population health interventions related to nutrition and to youth tobacco use. She's interested in environmental determinants of healthy diets and is involved in a number of retail food interventions to improve diets, including healthy corner store projects, mobile food vending projects, and other projects aimed at creating healthy retail food environments. She worked with us here at Health Canada in collaboration with our federal, provincial, territorial group on nutrition to produce the Measuring the Food Environment in Canada report and the manual that will be discussed in today's webinar. Also joining us, Dr. Catherine Mah. She leads the Food Policy Lab. It's a multidisciplinary program of research in the policy and practice of public health with a focus on health-promoting innovations in the food system. Her work integrates population health intervention research and policy action on environmental context for consumption. She holds funding from CIHR, Health Canada, and the Leslie Harris Centre of Regional Policy and Development. She's Assistant Professor of Health Policy at Memorial University and is appointed at the Dalla Lana School of Public Health at the University of Toronto and the Centre for Addictions and Mental Health. She's a former member of the Toronto Food Policy Council and a founding member of the St. John's Food Policy Council. Welcome to both, and I believe Leia will be starting things off.
Thank you, Lisa. All right, so yeah, this is what Kathy and I look like for anyone who is wondering. And I'll advance the slides. There we go. It works. So, greetings, and thank you everyone for coming. We're super excited and delighted that there are 98 people on the call right now, which also makes me feel a little bit nervous. So hopefully this goes well. So yeah, today Bill and Hassan and Lisa have already provided a great background and introduction, so I will just get right started right away. This is a bit of a timeline for the time that we have left together. I'll give you an overview of the food environment. I'm assuming some level of familiarity with for all of the participants with what we talk about when we're talking about the food environment. We'll talk about the work to date that we've done and then get into the meat of the conversation, which is the actual food environment assessment manual that we've been developing over the last year and a bit. And then we have quite a bit of time for questions and discussion, so hopefully that's useful for people as well. So, of course, what we want in public health and in nutrition policy and promotion is healthier food choices at the consumer level or at the individual level. We think that there's good evidence that the food environment can influence some of the healthy or not so healthy food choices that people make. And so this is what, when we talk about the food environment, we're specifically right now talking about the retail food environment, not the home food environment or the school food environment, but specifically what kinds of things are accessible in people's neighborhoods. So there's this idea of geographic access. There's the idea of what kinds of foods are available in the stores that are accessible. So at the grocery store in people's neighborhoods, what kinds of fruits and vegetables are available, for example. Or in the convenience stores, what kinds of candies are available, or in the warehouses around, what kinds of foods are available, and determining the sort of food supply at the retail level. There's also, of course, affordability, which is very dependent on people's purchasing powers and incomes. When we talk about affordability in the retail food environment context, what we're really talking about is the relative cost of healthier options to less healthy options. So for example, in this picture you can see there's white bread on one side and whole wheat bread on the other side. And so we would say if they're both priced the same way, then there's no real difference. If white bread's cheaper, then that would be sort of negative relative affordability in terms of health. And pricing strategies to promote healthier foods are increasingly looked at as a way of nudging people's choices. We also can think about, I think I just skipped a slide. About the quality as well of the foods that are available. So in other words, if people even if foods are there, if they're sitting rotting on the shelf, and people who are on this call who might be from remote areas, northern and remote areas might be very familiar with this, that even if it's there, if it looks gross or if it's rotting on a shelf or if it's not fresh, then people won't buy it anyway. So Kathy and I, in our research together and in our sort of collaborative research program, we're focused on making healthier choices easier for at the consumer level, but also at the retailer level, because obviously for healthier choices to be easier for people to make, they have to be financially feasible for retailers to supply those foods at affordable costs and at high quality. So we think about things like behavior and environment and context, which are all features that can be looked at separately, but are all very interconnected. So for example, retailer behavior can actually determine the context for consumers. So there's different levels of outcomes that we're interested in, for example, at the retailer level or at the consumer level or at the community level, which we'll talk more about. But just to note that these things are all interacting with one another all the time. So here's two examples of very diverse food environments that are in Canada right now. So this is a neighborhood in Toronto called Lotherton Pathway. The closest discount grocery store is 2.5 kilometers away from the people who live in these apartment towers, and the people who live in the apartment towers are predominantly live on lower incomes. So you can see on the right that there's a road, and you can see on the left that there are train tracks. And the grocery store is across the train tracks from the people in Lotherton Pathway neighborhood. So if you lived here, a lot of the people in these neighborhoods, in these apartment towers, don't have access to private vehicles, and transit's not wonderful. So the question is, what would you do? And this is a bit of a rhetorical question, but what would you do if you were in this situation and you were trying to get to the discount grocery store? This is what people in Lotherton Pathway did. They actually got some crates and put them up so they could jump over the fence, cross over the train tracks to get to the retail, including the discount grocery store. On the other side of the spectrum, so that's a very urban environment. On the other side of the spectrum, we have here's Newfoundland. And here, this arrow's pointing at Branch, which is here. And the closest supermarket in Branch is 62.5 kilometers away. So it's very different. And when we talk about geographic access, 2.5 kilometers might be really far for a downtown urban neighborhood in Toronto, but in rural and remote settings, 2.5 kilometers is actually really close. So it's not the case that there's an absolute distance that we would consider poor food access or good food access. So this is just to provide some context, and you might be thinking one way or the other depending on the context that you find yourself in. So let's talk a little bit about the work to date, which Hassan has already mentioned. So first of all, what do we know about the food environment in Canada? So in urban Canada, there's actually probably a lot of you have heard about this concept of food deserts, which is the idea that there's in deprived areas or vulnerable areas or lower income areas, there's poorer access to sources of healthy foods like grocery stores and fresh fruit and vegetable markets. On the other hand, food swamps are the idea that there's also lower income areas, but that the prevalence, the predominance of food is less healthy. So these landscapes might be lower income, but also dominated by fast food outlets, convenience stores, and other sources of less nutrient-dense foods. And so in urban Canada, at least, the evidence is much stronger for the existence of food swamps being widespread than for food deserts. And this is going to be published soon in the Canadian Journal of Public Health. We did a scoping review recently that showed that, in fact, this whole concept of food deserts doesn't seem to be a huge problem in urban Canada, at least. There is a fairly mixed impact of the food environments on diet and weight-related outcomes. So 85% of the studies that have been done to date in Canada have found some association in the expected direction. So for example, studies have found that food purchasing among kids who live in neighborhoods that are dominated by fast food outlets tend to have more fast food purchasing. In some studies, cardiovascular disease outcomes have been related to the density of fast food outlets, etc. So the vast majority of the studies that have been done to date are cross-sectional in nature, which is a limitation methodologically, And there is a ton of methodological heterogeneity. So in other words, people have been defining the food environment so differently across studies and across contexts in Canada that it's really difficult to say, this is the impact of food environment X on diet-related outcome Y. We're not there yet with the evidence. And then one of the other major limitations is that 7 in 10 of the studies, so about 70% of the studies that have been done to date in Canada, have focused specifically on urban areas rather than rural and remote areas. And some have focused at a province level, and a couple have focused at a national scale. But definitely cities have been most studied in this area. So in terms of some of the work to date, Hassan has already mentioned the Measuring the Food Environments in Canada report, and this came out in 2013, and I worked on that along with Lisa and members of the Federal, Provincial, Territorial Group on Nutrition. There was also the Working with Grocers report, which I don't have here, but there was also, so we presented at the Canadian Obesity Summit some of the workshop material that we've created. Rachel Engler-Stringer, who I believe is on the call, coordinated a great symposium and workshop in Saskatoon last May that brought together a bunch of people who are interested in this kind of thing. We presented at CPHA last year. This is a web resource that you can Google if you want, or contact us and we can send it to you. Policy Options for Healthier Food Environments in City Regions. That's a discussion paper that Kathy and I and our colleague Brian Cook wrote. Then the Nutrition Resource Center has hosted a couple of different events and workshops that we've also presented at. There's just this past a couple of weeks ago, the CDPAC conference that Kathy and I worked on some presentations for. And then upcoming, if you don't already know about this, I thought this might be relevant to also throw in that May 11th in Toronto, there's going to be a Healthy Eating in Today's Food Environment workshop with the Nutrition Resource Center. So that's, I think, also going to be very interesting if you're already interested in the food environment. And then, as I noted, the Canadian Journal of Public Health, if you can keep your eyes peeled for an entire supplement based on the food environments and health in Canada. And so there's going to be quite a wide variety of research that's going to be profiled in this supplement, this journal supplement, that will come out later this year, I believe, including some of the research actually quite nicely fills some of the gaps that we identified with our scoping review in terms of looking at rural and remote areas, in terms of looking at Indigenous communities and policies and natural experiments and that kind of thing. So that's exciting. And then we also have some work with, this is some ongoing projects looking at corner store interventions, healthy corner stores, and also this is a project that Kathy's leading with funding from ONPP, Healthy Corner Stores in Newfoundland. And there has been, even though it's the same, well, quote unquote, the same kind of project, the Healthy Corner Stores, the context makes the outcomes and the process so different. So we've been learning a lot over the last few years. And Hassan also talked a little bit about Fresh It, a project that we're working on as well. And it's a knowledge to action kind of project. So it's not the aim of it is not to create new knowledge, but to work with communities in Canada to sort of facilitate using the tools that we've already created so that they can move towards action on their food environments. So there's 3 components to the toolkit, and this is one of a series of 3 webinars that will go over each of the different components. So we have today, we'll talk about the Health Canada Food Environment Measurement Manual. And then there's also the Evidence Application Guide, which will help people to determine how to apply evidence to guide their actions. And then there's also the Policy Readiness Tool. So this will be adapted. This is from Kim Rain's group out in Alberta. Their group has developed a policy readiness tool, and we're sort of adapting it for the food retail environment interventions that we're hoping that these communities that we're working with are going to be able to create and then implement. So we're partnering with obviously a bunch of partners, including CDPAC, Health Canada, and we are partnering in dissemination, training, and piloting food environment measurement and action tools this spring, hence the webinar series at the moment. So just so you are also all aware, there's another webinar coming up on March 24th and the final one coming up April 7th. And so if you're interested and you're not already either a Freshit pilot site or a Health Canada pilot site to use the manual, and if you're interested by the end of this call or this webinar, we would welcome you to contact us to get more information and to sign up if you're interested. So this is just a great little map that shows the pilot sites that we already have engaged, and so you can see that there's several of them and they're across the country. The ones in the dark red are technically the Freshit regional pilot projects, and the ones in the blue are Health Canada manual pilots. And so we'd love to be able to populate this this map a little more with other people who are interested in using the manual. All right, so let's now, for those of you who may have seen Kathy and I present before at the variety of conferences that Hassan mentioned and that I also went over, this is where we get to something new. So this will be worth your time. So this is the actual manual. So, and this will be available as well, like I said. So this is a bit of a chicken and the egg slide. So one of the key informants, Hassan mentioned that I talked to a lot of key informants to develop the manual. I think there were about 38 or 40 people that I talked to. And one of the key informants especially said, you know, it's hard because it's a little bit of a chicken and egg situation, because you have to know beforehand what's possible to do in the food environment before you even measure something. But the measuring can tell you the extent of the problem, but you already have to have an idea of the problem before you start measuring it. And so in my conversations, especially with public health practitioners, this kind of theme kept coming up and up and up. So here's a little graphic that I developed to talk about. Before we even begin, let's sit back and think about, before you go out with your shelf space measurement tools or your inventory measurement tools or your mapping, let's think about what's the relevance. So what is the problem? What does the literature say about the problems associated with this kind of food environment? So this might be, and this is not only determined by the evidence of the scientific evidence, but also what are people in your community talking about with respect to the community food environment? Are they talking about things like, well, we're upset that all the kids seem to go to McDonald's at lunch or Tim Hortons at lunch, or getting, you know, whatever it is that they're getting at lunch from the convenience stores, etc. If so, then maybe you want to map fast food outlets or convenience stores around schools, and maybe that's where you begin. Is the problem, are people talking about other things, like maybe candy-free checkout aisles in grocery stores as a potential solution to improving children's diet quality? Or are they talking about menu labeling? So there's many, many options, but first it begins with, I think, a good understanding of what people are even thinking is the problem to start. So that's the relevance piece. The resources piece are what do we have available to us? So there are, and for those of you who've done food environments, you know this already, that there are so many different, there's over 500 measures of the food environment that exist, and there are many, many different sort of levels of data that you can collect on the food environment. So the simplest one, especially in urban communities, would be just mapping grocery stores or mapping fast food outlets. There are different inventory type measures that you can spend an hour or an hour and a half in each grocery store in your community assessing things like how much does the whole wheat bread cost, how much does the white bread cost, how much does the low fat milk cost, how much does the high fat milk cost, etc. There's shelf space measures, there are different kind of relative indices, etc. And so who do you have to even work on this project and to collect this data to begin with? And then what kinds of assets do you see in terms of who can help you collect the data? And then second, where do the gaps exist? Because that will also help you to determine what kind of food environment measurement you'll be able to use. And then third, there's the response, which is what are the opportunities, levers, and threats to using the data that you're collecting. So in my opinion, and this is just my opinion, I don't see the point in collecting information if you will not use it, or if you're not able to use it because it's outside of your jurisdiction. So, for example, if you are not able to impose a tax in your jurisdiction, then it may be less meaningful to collect information on how food taxes vary across your region, because even if you collect that data, you can't do anything about it. Or, you know, so it's thinking about how can we actually respond to this and what levers do we actually have at our disposal that will help us to determine, again, going back to the relevance. So this is what I think is really, really important. I don't mean to belabor the point, but I do want to say that this can't be underestimated, the importance of thinking about what's the real problem, and then that from there follows how are we going to measure it. But in that context, you also need to be super aware and conscious of the responses that are even available to you. So here's sort of the 4 steps that are talked about in the manual. Let's map it, layer it, share it, and then act on it. And then once we act on it, that might be going back to map it again, depending on what happens in your community. So the first step is, in the manual, we talk about the core maps. We talk about where to find administrative data, and talk about using systematic direct observation, which is also called ground truthing. So this is where you get a map of your community, you get a list of all of the food stores, and then you go around to every food store in your community and go up and down all the streets. Obviously, this is more doable for smaller communities, and it will take less time and less human resources to collect this information than if you were in a large community with many, potentially thousands of stores. So there's context will determine what kind of method you use to find your data. Often, in terms of the administrative data, we have public health, for example, in Ontario, public health units have data sets where the public health inspection databases are fairly accurate and up to date in terms of all of the food premises. In Newfoundland, I believe, it's an entire provincial database instead of a regional database, and in different provinces, these data, the food inspection data, are collected differently at different levels. So you have to figure out for your context, where are these data housed? Many of them are open source. So for example, in Vancouver, you can go, and I think in a lot of cities actually, you can sort of click on the different reports in the public health inspection data for many of the restaurants or for all of the restaurants that have been inspected when you're just as a regular consumer. And the data that are used to create those maps in your community are generally open source, and you just have to find someone at that regional health authority or public health unit to give you that information. So there's those data that you need to first find, and again, it's different in your jurisdictions. And then there is categorized data. So when we think about, and just being very clear and explicit about the rules and assumptions for how the data was collected and how you're going to be categorizing it. So often, for example, we use NAICS codes, which are North American Industry Classification Standard codes, which will tell you the definition of a grocery store, the definition of fast food, the definition of a convenience store, a warehouse club, a sit-down restaurant, a bar, etc. So you can figure out, because often the public health inspection data is not categorized according to these NAICS codes, which can make it easier, which makes it more difficult for you to recategorize everything. But the manual talks about how to do that, and then how to map it as well. So we've worked with AFIO, which is the Association of Public Health Epidemiologists of Ontario, and they have developed a core indicators measuring the food environment's core indicators piece. And so you can actually, and that's actually in the appendix of the manual, so it is very specific about what data to use and how to create these maps, etc. You do need someone with GIS capacity. You need someone who knows, for example, how to use ArcGIS. And then, and then there's the broad and the general description versus the core indicators. And there's also derived indicators, which I'll show you a little bit. And just to, again, to be clear, the way the manual is presented, these are supposed to be a starting point rather than an end point. So it's great to have just a broad map of where are all the grocery stores, where are all the fast food outlets, where are all the convenience stores, for example, in your community. But as you go and as you continue to get stakeholder input and as you continue to consider things like resources and response, your maps will evolve over time and your food environment assessment will evolve. So here's just an example of a broad map of the grocery stores in Middlesex County in Ontario. So there's the City of London in the middle there. You can also see in blue the public transit lines, and then Middlesex County is in black outline around the City of London. And so they mapped not only the City of London, but also all of the grocery stores in the surrounding county as well. So that's one example of a food environment map that's been created. This one was done in Calgary, Alberta. And so this one shows, this is a modified retail food environment index. And so their benchmark for this particular project, they said anything in any area where there is more than 10% of outlets are healthy outlets, i.e. grocery stores or fresh specialty stores that sell, fresh fruit and vegetables, then we're going to consider that our benchmark. So above 10 or above means that we're going to consider that a healthy food environment, and less than 10 is we're going to consider that an unhealthy food environment. So you can see that's how they have defined things. And then the second step, which is very related to the first step, is layering on to the map. So once you have the actual map and you have things located, the specific relevant food outlet types located on your map, then you can layer it. And so there's two different kinds of layering that the manual talks about. The first one is consumer nutrition environment layering, and the second one is layering on sociodemographic data. So consumer nutrition environment is different than the geographic axis. So with the consumer nutrition environment, for example, you can go in and measure all the shelf space dedicated to fresh fruit and frozen, or fresh, frozen, and canned varieties of fruits and vegetables, for example. You can also measure all of the energy-dense snack foods that are available in the different stores. There's, and the manual talks about both shelf space measures and the Nutrition Environment Measure Survey, which we have used and adapted several times for use in Canada, and those are also available upon request. So, and they're fairly, not necessarily complex, but there's a lot going into the protocol, so I won't spend much time other than to say this actually requires people to go into all of the outlets that they've identified as being relevant for health and to actually measure elements of the food environments within stores or restaurants. And then there's the sociodemographic data, and this is from other sources of administrative data where you can look at things like proportion, like either marginal deprivation indices, you can look at median family income, you can look at neighborhood renting rates, etc., things that you think would be important to define sociodemographic features of an area and layer that onto either the grocery store access or fast food access or convenience store access, etc. So there's two different kinds of ways to layer information into your maps. And then in terms of some of the key informants in the manual, also there's a lot of do's and don'ts from the key informants that I talked to. So in terms of this layering, the key informant said, it's really important for you to keep your questions or your problems in your minds as you're developing your maps. The second point was don't overinterpret your maps. So it's often, this is again where in epidemiology, causation does not equal correlation. So you can't say necessarily that there's poor access to grocery stores in this neighborhood and therefore everyone's diet is poor. You haven't necessarily done that research, so you can't claim that. But it's enough of I think, an important piece of evidence to suggest that this might be a problem. And then the other important thing is do think about context and behavior and think about how to create new questions. So here's an example of layering the food environment with sociodemographic data. So this is a map of Toronto, and you can see the darker the red, the poorer the food environment. This is, again, using a different version of the Modified Retail Food Environment Index, where there's the mix of food retailers is more towards the unhealthy food sources being more predominant. And then in the blue outline is all of the lower income areas in Toronto. And so what they found in Toronto was that, in fact, this idea of food deserts, if for example, all of the blue outlines would be in areas that were really dark red, then you could say, oh, look, it's mostly food deserts here. But in fact here, the blue lines don't seem to be overlapping with the less healthy food retail environments. And so they concluded that, in fact, income and geographic food access are not necessarily very strongly correlated. And this is an example of the consumer nutrition environment. So for example, with the NEMS, we look at what are the end cap displays and how much, what kinds of things are available in checkout aisles. how many different kinds of, fruits and vegetables are available, and what are the prices and what are the qualities. And so this is pretty much a little checkboard that you take around with you, or you can do it on your smartphone, and to keep track of what is actually available and of good quality and affordable within stores. And here's an example. This is from my PhD project in the region of Waterloo, where we've actually measured all the shelf space of the fruits and vegetables and energy-dense snacks within 1 kilometer of people's homes. So in all of the food stores in Waterloo region, in Kitchener, Cambridge, and Waterloo, and found that actually there was over 3 times as much shelf space dedicated to junk foods as there were to fruits and vegetables within an average walk of 1 kilometer of people's homes in the 3 cities. And interestingly, and as a PhD student, I was thinking, oh man, everyone's going to be so impressed with my multi-level models and my complex statistics that I'm using to, relate diet quality to the food environment features. And in fact, this was the thing, this relatively simple measure that was just a descriptive statistic that really resonated with people. And so that was a learning moment for me in my career, thinking, it's not always the complex stuff, or maybe never the complex stuff, that really gets picked up by people. It's these messages that you can use to talk about the issue. So the third step in the manual is to share it. So once you have collected the data, once you've mapped it, once you have layered on the important and relevant features for your community, then it's time to share it. And so here's an example of, so Kathy and I have developed a little Healthy Corner Store game. And this was from a little workshop that we did in St. John's, and invited a bunch of participants and said, what would your ideal Healthy Corner Store look like? So we gave them these little toolkits, and they could build their Healthy Corner Store in their own communities. And it was so interesting because it got people who are interested in public health thinking about how they would feel about things if they were actually the business owner. And when we've done this at different places, it's been so interesting to see how the different audiences have responded. So for people who are actually corner store owners, they will say, okay, well, we can, maybe we'll move the fruit and vegetables around, or maybe we can bring in a few more products. But we can't stop selling pop because that actually makes a lot of money and the distribution's really good, so we don't even have to do any work to stock the Pepsi and the Coke shelves. They're just there. And, maybe we can move some things around. But in my experience anyway, the changes that are being proposed are a little more modest than some of us people who have only ever been in public health, who are like, we're going to have juice bars and smoothies and yoga studios in our little Healthy Corner Store, and we're not going to sell tobacco, we're not going to sell pop, and we're not going to sell candy, and but we don't think about things like distribution or foot traffic or layout or the practicalities as much as obviously someone who actually owns a corner store. So that's been another sort of fascinating piece of working with retailers, learning about real life for people who are doing these population health interventions. So that's one way of sharing it, community gathering and community sort of facilitated learning. And then there's also going to talk about it to people. So I think it was not last August, but the one before that, I talked to the regional council in the region of Waterloo about some of our findings on the food environment. And that is actually one of the report that Public Health made for the regional council is actually one of the appendices in the manual. So that's available as a resource for people. One of the things that struck me again that I learned was anyone you talk to, you have to frame your findings of the food environment in terms of their own strategic plan and their own mission and their own vision and goals and objectives. So, for example, in communities across Canada, there are, and these are called different things in different provinces, but in Ontario it's the regional official plan or the city official plan. Other places call them city plans or development plans, etc. But I'm pretty sure most everywhere in Canada has one. And if you take a look in your own community, do they or don't they have any references to food? So in Region of Waterloo, Regional Official Plan, this is, I believe, from 2010, it specifically says in there, the region and or area municipalities will ensure that development occurring within the urban area is planned and developed in a manner that, and then gives a bunch of different criteria, and criteria G is, in a manner that facilitates residents' access to locally grown and other healthy foods in neighborhoods. So it's actually in the strategic plan of the region of Waterloo that they want to support and facilitate access to healthy foods in neighborhoods. And when I originally was starting my PhD and sitting down with public health planners at the region of Waterloo, they said, we have this language in here, but we just don't know how to interpret it. And we don't have any specifics for what do we actually mean by access to locally grown and other healthy foods. So that was, and that's still an ongoing definition process. In the City of London, for example, they have 91 mentions of food in their official plan. And they have an actual food charter that's supported by the policies in the official plan, which say all Londoners should have access to food within their neighborhood. It doesn't say what kind of food. They also have another line in there within that sort of access to food category that says they should encourage groceries, farmers markets, and community garden uses in areas that have been identified as a food desert, which is also really interesting. So all that to say, this is a starting point. When you're talking to regional or municipal decision makers, it's a great idea to be able to go with your information and say, and also this is how what we're doing will contribute to your own stated goals. And that's not only applicable to your municipal or regional policymakers and decision makers. That actually applies to everyone who is in the sandbox that you're playing with when you're doing your food environment assessment. So for example, business improvement areas are often really interested in this kind of thing because food is big business. There's also local producers. So the local food movement is huge, and it's a growing movement in Canada in all areas of the country. And so what are the local producers? What's their goal? What's their end game and goals? And why would they want to participate in something like a food environment assessment? Local retailers is an obvious one as well. For example, if you're thinking about doing something like a healthy corner store in your community, you need to get to know the local healthy corner store owners. And the bigger chain convenience stores may or may not be as willing to engage with you as the local mom and pop shops, who might have more decision-making powers about their own retail space than, for example, 7-Eleven or Mac's that are owned by, that are more like franchises and don't have their own sort of local ownership or decision-making power. Youth groups and health groups and I had another one here, seniors groups. This is another interesting area, and this is a little bit, I think, often outside of public health as a partner, because as public health people working in government, we're not allowed to advocate for anything. As an academic, I can advocate and I can shoot my mouth off whenever I want. That's not exactly true, but it's a little bit true, more than my colleagues who work in government. But by partnering with people who don't have the same restrictions over what they can say, it actually can be a huge boon to your goals if you're able to get youth groups to buy into what you're doing, or health groups or seniors groups, because and this is again with age-friendly city planning, a lot of, as seniors age and and begin to drive less and less, then what happens to their access to a grocery store, especially if public transit's not great? So there's a lot of different kinds of either NGOs or other kinds of organizations who may be willing to partner with you to spread some of the message in ways that you, as if you are a government employee, may not be able to do so well. There's distributors as well. So what are the distributors doing, and what would they potentially want to get out of it? There's the seniors groups. And then there's also local economic development groups or people within the government who can potentially see a lot of potential for economic development in creating these retail spaces in communities that sell nutritious, fresh foods. So that's just, again, to think about who are some of the players who you may want to engage in something like a food environment assessment, or at the very least sharing it with these kinds of folks who may be willing to support it, or and even if they're not willing to support it, getting a sense of why they might be opposed to something like this or why they would be willing to support it is still really useful. And then so finally, step 4 is to act on it. And so the 3 different kinds of ways that we have foreseen acting on food environment assessments are the following. The first one is gathering more evidence. The second one is influencing programs. And the third is influencing policies. So the most likely outcome will be because, so here's the thing, is that most Canadians, or a large proportion of Canadians, still think that obesity, chronic disease related to dietary intake is completely within the responsibility of the individual. And so when you start talking about food environments and when you start talking about environmental determinants of dietary intake, then you start getting people throwing up their hands saying, no, 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 this is the government interfering in what people should be eating, etc. It's not, no one's putting a gun to their head to eat that bag of cookies. So there's a lot of stigma and there's a lot of perception that food choices are within our entire control. And so I think that's one of the things that I've experienced when I've been talking about this kind of information. And so I feel like over the last few years I've been on a bit of a soapbox talking about how our collectively poor diet quality makes complete sense when you think about the food environments in which we live and work and play. And so part of the gathering more evidence is that may be the thing that your regional policymaker or your city policymaker or your the employers or whatever happens next with this information, that may be the thing that they want you to do is, well, okay, we see what you're saying, but you have to gather more evidence to see, what's being done in other jurisdictions or what are the other options that we have available to us, etc. Then I think so the influencing programs and policies, because of the novelty of this area of research, I think it's so important to evaluate programs or policies that are created and implemented related to the food environment. And so here are some examples, and this is just my own little categorization that seemed to make sense to me, of food environment, food retail interventions that can happen. So we can either focus on changing the environment, we can change the retailer, or we can support consumers. And so some examples of these are, if you're trying to change the environment, some ways to do that would be, for example, permitting temporary farmers markets in different locations in your community. Or supermarket incentives. So this is big in the States right now where they're incentivizing supermarkets to open in food deserts in the United States. There are other kinds of programs that are beginning, like mobile good food vending across Canada, actually. And so what's the impact of that? Those are trucks, refrigerated cube vans or buses that bring high quality, fresh produce to lower income, underserved neighborhoods. And then there's zoning restrictions. So at least some communities across Canada have implemented zoning restrictions where you actually cannot open a fast food outlet in the city. That's in Qualicum Beach on Vancouver Island. Or I know at least a little while ago there were some municipalities in Quebec that were looking at how to use zoning to restrict fast food outlets and convenience stores from opening within a given walking distance, for example, of schools. So what would that look like? In terms of changing the retailer, there's things like healthy corner store programs that are taking off across Canada. There's the nudging incentives, and this would be an example would be moving healthier snacks to eye level or closer to the cash register, and little ways that you can, like with using shelf tags or other kinds of under the radar kind of psychologically driven incentives that will increase consumer purchasing of healthier products. And there's also things like menu labeling, which can help to change the retailer not only by providing information at the point of purchase for consumers and restaurants, but also there's some evidence that suggests that when you force restaurants to label their menus, they actually end up changing they reformulate the products that they're offering to decrease the caloric content or to decrease the sodium or the fat content. And then, of course, there's supporting the consumer. So this is being done more and more through mobile apps, through things like grocery store education and grocery store tours. and things like in-store recipes and food skills training as well. And then, so finally we have at the end of the manual are a bunch of appendices, which we are hopeful will be very helpful for people. So the first one is a list of key informants, and you'll find that they are from all across the country, and they, I think most of them would probably be, well, they're all willing to have their names out there, so if you're interested in connecting with them, I'm sure that that's a possibility. And then Appendix B is a list of resources. So this is just a huge compilation of a bunch of different resources that exist in terms of measurement, but also in terms of policies, in terms of programs related to the food environment, how to share information about the food environment, etc. Appendix C, this is the FEO and FAC, Public Health Agency of Canada, the concrete steps to mapping your food retail environment. So this is the specific methodological kind of, this is how you do it. Appendix D talks about layering the sociodemographic data over the food retail maps and how you might find that information from administrative data sets and how you might layer it. And then finally, Appendix E is in the Share It component, which is the Region of Waterloo report to Regional Council on the food environment findings. And finally, now we have our questions and discussions. And you know what? I realized I did not stop at all throughout that presentation. So maybe, Lisa, should we start with questions from the group?
Actually, Leia, that's a great idea. If we could just start with a couple of quick ones, some notes of clarification as you were going through. So slide 50, the bottom part was cut off.
Okay.
What did the red shading indicate on slide 50? Right,
so that was areas where the benchmark was unmet, and the yellow is where the benchmark was met. So that is in the red. That's where the percentage of healthy food retail outlets in that administrative boundary was less than 10% or less than 7% in impoverished census tracts.
Excellent. Okay, what is ArcGIS?
Oh, ArcGIS is the software that you use to create maps and to use layers. So I am not a geographer, but many of the bigger public health and the regional health authorities have people who know how to use ArcGIS. But it's a software program that you use to create maps and do geographical analyses on things.
Okay, excellent. I'm just going back to the top of my list to see what came in early on. Are there data collected around schools?
Maybe we could get more specific. Do you mean, I'm not really sure what that means.
Okay, we'll get clarification and let's move on to the next one.
Sure.
If we wanted to do a NEMS in our stores using a smartphone or an iPad device, is there a program or app that does this already, or would we need to design, program something to do this?
So we have developed this, and we have it available. But what we're finding is that it's really important to be able to adapt the NEMS for the to become sort of to measure the really appropriate foods that your community consumes frequently. So a little bit of column A and a little bit of column B in terms of it's there, but you'd probably want to modify it. And Kathy, maybe you could weigh in here with your experience with adapting it for Newfoundland.
Sure, Leia. So I'll weigh in here on this and maybe just a few other things as the rest of the questions roll out. But on the NEMS in particular, I think Leia was the point that she emphasized is really important in terms of really thinking about the ground rules and the assumptions for doing these types of assessments. So if you are going to do something in detail, and which takes quite a bit of time and resources, such as a NEMS type tool, then the effort to actually adapt it is actually more important than kind of the speed that you gain out of doing it through the mobile app. And that's totally kind of my own perspective on it. The mobile app is more of a tool to kind kind of increase the quality of your data collection to kind of reduce error and also be able to kind of speed things up in the field. But it doesn't replace, for example, having a really good conversation with your stakeholders in advance to say, what needs to be in that survey or not. And I see there was just a quick question about what does NEM stand for. So that's Nutrition Environment Measures Survey.
Excellent. Okay. The next question. Are there any data in the Niagara region?
So you would have, in the Niagara region, you'd have probably your public health inspection data based on a hedgehog system, which is the system that most public health units in Ontario use to collect food inspection data. So what likely you would have access to if you have access to public health inspection data is it would have columns about, they would most likely be geocoded locations and have the name of the store and then have what category it is in. One of the issues with using public health inspection data is that public health inspectors are not looking for nutrition, they're looking for food safety. So that's why things are categorized in public health inspections differently than we would want to categorize it with food environment data, because what we're interested in is what are the opportunities and costs for people to access nutritious food, whereas a public health inspector is interested in what are the risks of someone getting a foodborne disease or foodborne illness from eating or buying food from this location. And so, for example, when I used the Region of Waterloo public health inspection data, I had to go through and recategorize. And sometimes I found, and maybe things have improved, but like, what was it? It was Zellers, when Zellers was still around. Zellers was classified as a cafeteria, as a grocery store, and as a restaurant in 3 different locations. And so there's some inconsistencies that I found with the data that I had to go through manually and say, and because I was living in Waterloo and grew up in Waterloo, I knew, oh, that restaurant is, a sit-down restaurant, or that restaurant's a fast food outlet. Google and Google Maps and Street View is an excellent tool for determining what kinds of outlets are in your public health inspection data too. But the great thing about public health inspection data is that it's relatively accurate, it's free, and it's typically been geocoded already. So you don't have to go through the process of finding the addresses and uploading them to create your maps to begin with.
So I'll comment on administrative data as well. So this is, I think, a real opportunity where Leia was talking about, what can you actually do about this? What kind of assets and resources do you already have in your region? This is where you might actually want to think about uncommon allies, particularly for those of you who are working in kind of smaller jurisdictions or kind of less well-resourced jurisdictions, is that most jurisdictions, for example, do the public health inspection, but may also have a business registry of some kind. So in that case, you would want to make friends with your economic development people or your local statistics agency to actually work with economic business registry data, which actually might classify some of your stores into more retail food environment relevant categories, so industry categories rather than food safety risk categories, and that may also help you if you're starting to kind of merge multiple administrative data sets to get a more comprehensive picture of your food environment.
Okay, I think we have about 5 more questions so far coming up. Let's move to the next one. From my experience in working with retailers, there's a tension between making changes toward a healthier eating environment versus selling foods that are not healthy but profitable. You illustrated it with the example you provided about corner store owners and reluctance to stop selling soft drinks. Any incentives, disincentives to encourage change from federal level to encourage change from business owners, restaurants, retailers, and grocery stores?
That is a great and very broad question. So at the federal level, Kathy, what are your thoughts on that?
I agree with you. This is actually, whoever asked this question has really kind of hit the nail on the head when it comes to dealing with population nutrition interventions, and it's why Leia and I and our colleague Brian Cook are increasingly kind of talking about both levels in terms of working with consumers or thinking about kind of the impact of food environments on consumers, but also thinking about the impact of the way food environments are or the food system on our retailers and distributors as well. So these two things, and part of it is actually thinking about kind of what are the policy levers in place that retailers have to deal with. So, retailers have to deal with, retailers who sell tobacco have to deal with all sorts of policy, regulation, and actually, frankly, kind of a lot of hassle that isn't kind of conducive to them necessarily operating a successful business. So I think that some of the food aspects can also be thought of in that similar vein. So what do they deal with in terms of, advertising and promotions from their distributors? Are they actually adequately supported through provincial regulations? Are they supported through kind of municipal policies? Do they have to pay property taxes? Do they get their snow shoveled in an appropriate way? Those are some of the pressures on retailers that actually might be the sort of true underlying issues for their hesitance to take risks where we see with things like changing their actual product mix. I think another great example actually comes, I'll kind of hand it back over to Leia. Another great example of a retailer that may think about risks in a different way is pharmacists. And Leia's been doing a lot of work thinking about the pharmacy retail sector.
Right. So I have this. So in September 2014, for those of you who don't know or who might know about this, Little Champion, I don't know how big he is, but he's my little champion in Bedeque, Nova Scotia, small town, approximately 800 people on Cape Breton Island in Nova Scotia, and he is a pharmacist and owns a PharmaSave. And he decided in September 2014, I'm a pharmacist. It's so incompatible with my values as a healthcare professional to be selling sugary drinks because I know how harmful sugary drinks are for people. So he just took them all off his shelves. And so I read about him in the news, and then I called him up, and I was so thrilled because he's the only person I know who's done something like this at potentially significant risk to his own financial bottom line, that I wanted to know why he did it. And so anyway, so conversations continued, and he gave us all of his sales data to look at how his business has been evolving over time, and we also looked at all of the carbonated soft drink sales in the whole town, in the three food retailers that are in that town, and found that it actually, not statistically significantly, but there was actually like a pretty big drop in carbonated soft drink purchases in the town over the time that we were looking at it before and after his pulling all of the sugary drinks. And one of the things that made that really interesting is that you can now find food everywhere. You can find food in hardware stores and in pharmacies, tons of food now, especially now that Loblaws own Shoppers. There's Shoppers, drug marts are turning into little mini grocery stores. And so so I think for different retailers, there's different risks associated. He was able to take the risk because the majority of his revenue came from selling drugs and not from selling food. But for people whose revenue really depends more on selling food, and especially the foods that are really easy to sell, that already have billions of dollars in marketing behind them, like the Cokes and the Pepsis and the Lay's potato chips, etc., then this is definitely, I think, an issue where we need to spend more time thinking about how do we actually make the healthy choice easier to make for retailers, not just for consumers. But I also think that at the federal level, some of the things that have been talked about by the new Minister of Health, for example, things like the sodium reduction and marketing to kids and other kinds of federal policies will potentially indirectly affect the food retail environment as well. Because if you enact some sort of, federal sodium legislation, then that's going to automatically change the retail food environment to have less sodium available in retail outlets. So
another kind of point to add to that is, I'm just looking at kind of the list of people on the line today, and we have a lot of kind of public health people, a lot of community-based non-governmental organizations, and some researchers as well. And when you kind of broach those risk conversations with retailers, I think a big question to ask, like that we all ask ourselves, is what do we actually bring? What do we actually offer to that retailer besides asking them not to sell certain things or kind of take that risk? Well, actually, we can help to mitigate some of those risks by using things like our evaluation capacity or our capacity with community connections. So can we help that retailer to understand their community needs better? Can we help that retailer to actually document their sales in better detail or some of the impacts for their community in a more systematic and robust way so that they actually have better data to incorporate into their business planning? And that can also help them to really understand that, hey, we're on your side and thinking about and the potential risks and potential benefits at the same time.
Okay, can you talk a little bit more about what is in the nudging category of interventions?
Yes, I can, and I can also send some papers that are relevant to Nicole if she would like. So basically it's the idea that you're not taking choices away, that you're not removing choices, you're just incentivizing sort of at a subconscious level making healthier choices. So it would be things like moving the healthier products to end cap displays where they're more likely to be purchased just because they're easier to access, or putting healthier cereals, for example, at eye level rather than at the very top or the very bottom of grocery store aisles. So those kinds of things that don't actually interfere with anyone's choices but just have been sort of shown to impact people's implicit choices. But I have some literature that I'm happy to share as well.
Okay, thanks, Leia. Another one, in Saskatoon Health Region, we have a very small communities. Mapping may not be appropriate due to the existence of only one or fewer stores. A consultation may be a better approach, or would you recommend a process for this?
That's another really great question. I think is very applicable to many other small and rural and remote communities across Canada. So if you have a small community where you have one or less stores, then you don't need ArcGIS, you don't need GIS mapping to show everyone what they already know, which is where the store is located. So you have to think about what might be the most relevant information that you can provide for people living in that area, and especially for the decision makers. So in that kind of situation, then something like a consumer nutrition environment approach might be better and more useful, because you can say, compared to, you can, develop like a miniature food basket cost, or using the NEMS, or you can look at the relative prices of healthier to less healthy food options. You can look at the quality of the food in that environment. Although I also understand that in these really small communities, the store owner knows everyone in the community, so it would be really awkward for someone to go in taking notes on what they sell, and that may not be appreciated. So I think working with retailers in smaller communities, I think some sort of consultation approach would be better, actually, because they'd be able to potentially even tell you things that are more useful to you than what proportion of the vegetables are of high quality, which might be, well, our struggle is that distribution only comes on Tuesday, but when it's really snowy, we can't get the trucks to come in, and so we have to wait, and, that kind of thing.
There's two things that I'll add to that smaller community perspective. So one additional way to think about it is actually to size up from that community and think about the region instead. So after all, we know that food systems are organized at multiple levels so that we can think about, things like city region food systems, all the way up to kind of provinces, federal, and then international. And all of those different food systems overlap and intersect. So, for example, our intervention community where we're doing our Healthy Corner Store pilot is a small community of 235 people. And after doing that pilot, we're increasingly seeing that one of the most beneficial aspects of working in that community and doing the initial assessment is actually to take a province-wide and regional perspective. So actually taking that intervention and the lessons and thinking about all the similar challenges of towns of that size across that little area of the Avalon Peninsula that Leia showed in that map earlier on in the presentations, the Cape Shore. So that's one way of actually taking that small community's efforts, but actually combining forces with other communities in order to take kind of a regional governance approach to thinking about their retail food environment and the possible things that they could do. This is also useful when we're thinking about policy changes or supportive policies, and we'll get more into this into later editions of this webinar, sections of this webinar, and the third one in particular, where we're talking about, small communities not only have only maybe one store, they also have kind of very little policy capacity in terms of decision makers in that community supporting changes in that food environment. But if you actually have a couple of communities banding together, working with, let's say in Newfoundland and Labrador, we have a great association called Municipalities NL, which is the Municipalities Association that does a lot of capacity building around policy supports with different communities, then that's another way to kind of advance the agenda. Oh, and the other kind of note that I had made for myself is Leia also mentioned our Healthy Corner Store design game and showed the picture there. So I also just wanted to point out that later on this spring when we have our Fresh It website up, we'll also have a downloadable version of that Healthy Corner Store's design game that you can take then to your kind of consultation meetings. We've done it at sort of a more public event. I've also taken it to a planners conference, and that was fun because they didn't even want to talk about inside the store. They just wanted to talk about outside the store and the neighborhood. So there's lots of opportunities there for engagement.
Great, thanks, Kathy. We received some clarification on that first question. Are there data collected around schools? So the clarification is, are data collected about what food is available in schools, what is sold, and how many fast food outlets are close by?
There is no comprehensive data that collects that information in schools. Probably, so I know, for example, the COMPASS study, which is run by Scott Leatherdale, who's here at the University of Waterloo, is in a bunch of Ontario schools, and I believe that they also assess implementation of nutrition policies in schools. But each province, I believe each province has their own nutrition policy detailing what kinds of foods should be most frequently sold, less frequently sold, and then foods that are not permitted for sales in schools. But the implementation of those policies is really diverse. So some schools are like, yeah, we know there's a policy, but we're not doing anything about it, and there's still giant chocolate chip cookies for lunch and potato chips and French fries. And then others that have actually gone all out and are following the policies to a T. So yeah, there's no really great source of data on what schools are selling. And then in terms of the fast food outlets around schools, again, I'm aware of a couple of studies that have looked at the different kinds of food outlets, and I can again share this information with the group. There's two papers that I'm thinking of. One was done by Laura Salisky, I think, and one was done by Scott Leatherdale on the first one was that's sort of a national look, but in terms of community level, that would be something I think you would probably have to do yourself if you were interested to be able to tell your policymakers, for example, 80% of kids in high school in our community can walk to a fast food outlet within 10 minutes at lunch or something like that. Like if that's the information you want, you'll probably have to collect it yourself or at least do the mapping yourself.
And on the policy development side, there's been some interesting kind of intervention policy thinking around the fast food environment around schools that's been done in Quebec. So that's another resource that might be interesting for those who are on the call. And I have noticed that there are people who are on the call who I think work a lot more in the school sector than us. So I would also encourage them to kind of share resources. And we can kind of think about this as a larger community of learning.
Yep, and also I think a lot of those resources have been are in the resources in the Appendix B in the manual.
Oh yes, yeah, that too.
Yep, so that'll be a good source for people who are interested as well.
Okay, I'm just looking at the time. I think we have a couple of more questions we can squeeze in. With supermarket incentives, are you referring to encouraging supermarkets to open a store in certain areas of communities? Have you come across caveats that prevent this from happening at past store sites?
Yeah, so that's from Jill. Hi, Jill. Thanks for your question. And yes, that is what I was talking about. And it's the Fresh Food Financing Initiative in the United States. That's Michelle Obama's big thing, where they provide specific incentives to supermarkets to open in food deserts. The interesting thing about that is that they haven't really been proven yet, and there's actually quite a bit of research that's going on more and more. But they haven't really been shown to increase anyone's, fruit and vegetable consumption or change anyone's diet. And several of them that have been opened under that policy have actually shut down just because of lack of business. So I don't necessarily think that's the best solution, especially in Canada where food deserts aren't the same kind of problem that they are in the United States. And then I think probably the caveats that you're talking about in terms of past store sites is probably restrictive covenants, and that is also a huge problem. And for those who don't know, restrictive covenants are policies that grocery stores that are open will make agreements with the municipalities and say, we're going to open up, a Safeway here or a Loblaws here or a No Frills here, but no matter how long, or there's maybe like 40 years or 20 years or some ridiculous amount of time, that even after we're gone, you cannot open another grocery store in this space. And so then you have this horrible situation where there are neighborhoods without grocery stores, and not only do they not have a grocery, they used to have one, but now they don't, and they can't even open one in the site. So these giant buildings just sit empty for a really long time. And I think that there's some work being done to look at how to actually prevent restrictive covenants from existing, because I think it's not very controversial that that's not a great idea for communities. I think that's what you're talking about, Jill. I'm not sure. You can feel free to clarify.
Okay, and we have a question from Tanis, one of our pilot sites. What's the criteria for defining an establishment as a healthy corner store versus a less healthy corner store?
Great question, Tanis. So right now, the criteria is, yes, sure, we'd like to be part of your Healthy Corner Store project. It's actually not the case that you'd be able to walk in and go, oh, this is a Healthy Corner Store, which is a little bit, sometimes a little bit unnerving for me. I remember when I first walked into a Healthy Corner Store in Philadelphia, thinking, because in Philadelphia they have a huge Healthy Corner Store program, and I thought, this is not what I would call a Healthy Corner Store. But maybe that's because I was thinking of, smoothies and juice bars and yoga in the back of the store or something. But I think it's that people are trying to become have more revenue dependence from healthier food options than less healthy food options. One of the other things when we talk about healthy corner stores is, and this is not related to nutrition, it's related to tobacco. Can we say it's a healthy corner store if they're still selling tobacco in it? And some people would say no, you can't, because that's the thing that's killing, most people of chronic disease. So so there's no criteria, I wouldn't say, for defining this. In the Philadelphia case, they do have specific goals that different corner stores meet at, and so that you'd be the silver member or the gold member or the platinum member, depending on how many of the policies or how many of the different kinds of healthy foods that you sell, and if you're selling tobacco or if you're advertising tobacco, etc. So but yeah, there's no sort of accepted definition of healthy corner store.
I have two little additions to that. So I'll always remember one workshop that we did around healthy corner stores, and one particular group said, well, there's so many things that could be possibly kind of categorized as unhealthy. Maybe like the only thing that we can really agree on is actually providing water in the store. So that kind of gives you an example of one potential extreme that we could go to when we're thinking about categorizing it, but it is much more of a spectrum and a continuum. And so in fact, I'm going to kind of flip that question around, and the way I think about a healthy corner store is that a healthy corner store is actually a complex population health intervention. So it's not so much a benchmark, but actually about the intervention and the process. And that intervention happens at multiple levels. It happens at the distribution level, so in the food system. It happens in the store, kind of outside the store in terms of geography and built environment, and the outside of the store as well as the inside of the store. And it also works on building demand at the community level for people to kind of make that store viable.
Okay, I think we have about 3 minutes and we have 2 questions left. The first is, what has been your experience in working with convenience store franchises?
We are extremely hesitant to work with convenience store franchises because they already have their own marketing campaigns, and also the associations that represent convenience store, so the convenience store associations, whether it's Atlantic Canada or a Canadian Convenience Store Association, are funded by the tobacco industry. So Kathy and I tend to be very careful about who we work with, because we think that it really matters. Your integrity as a researcher and as a public health person really matters. So we actually have not yet worked with any chains, but so I don't have any experience with that myself. Kathy, do you?
Yeah, maybe I can just kind of add to that. I think, again, kind of categorizing into the chains, like if we actually take a closer look at the sector, for example, North Atlantic in Newfoundland and Labrador and elsewhere in the Atlantic provinces, on one sense they have a set of franchises such as the Orange stores, but they also actually provide things like point-of-sale systems to many of the independent stores. So I think kind of when we're talking about working with chains and franchises, I think it's more of a matter of what kind of distribution, like kind of learning from their distribution systems and the way that they actually work with their stores within their context, and then also thinking about how they're operating within the broader sector. So also thinking about what's their role in independent and smaller corner stores as well.
Okay, and the last question, if we could talk a little bit about risk in terms of the economic risk of making changes that retailers face.
Kathy, did you want to take that one?
Yeah, I'll just so when I kind of said risk before, I actually encompassed all of it in economic risk. I think like that's the economic bottom line is the main thing that retailers see when we're beginning to talk about a corner store intervention, because we're in the business of public health and they're in the business of running a business. So I think we always have to keep that economic risk in mind. And the question is not so much kind of setting aside that economic risk, but thinking about how we can find creative ways to mitigate that risk through things like through the supports that we can provide. I already talked about kind of things like providing data back to an individual store owner. But another kind of opportunity is just thinking about, again, kind of more broader in the sector, to think about the advocacy that they might be able to provide within the sector if they can identify opportunities for themselves that might be economically viable. So I think that's actually happening in a really interesting way, especially with things like impact investing that's happening in Nova Scotia, for example. So there's a great organization called FarmWorks that runs kind of impact investing, where communities can actually, buy shares and support through through community-led investments, business loans for businesses who are trying to make that conversion, and that helps to really kind of mitigate some of the risks, and the communities also have the buy-in. So I think there's a lot of really creative mechanisms for thinking about that economic risk, and we have to kind of put it front and center for us if we're going to keep working in this area.
Yeah, and maybe I'll just quickly jump in, not related to that, because I think that was a very comprehensive answer, but on the slides right now, you'll see that our next webinar is March 24th. We want these webinars to be useful for people, and so when you get the survey from Bill and from CDPAC, I'm hopeful that you'll fill it out, and this is one of the questions that you'll see it sort of at the top, is if you haven't begun a food environment assessment, what do you feel like you need to know from the very beginning? Or if you do have experience, because I know that some of the attendees have had experience with food environment assessment, what's one skill or piece of information you wish you had known at the beginning? And we're hoping that we can take your responses to these questions, because we didn't obviously have an opportunity to do it right now, because you already had many questions, which was great. But if you could help us out to make it as useful for you as possible by responding to these questions, we will incorporate answers to or incorporate your insights or your questions into the next webinar as well.
Thanks very much, Leah. It's Bill here. I know we're at time, but I just wanted to end by thanking you, Leah and Catherine, for your presentations today. We really appreciate you joining and sharing with us. And thanks to Lisa as well for your superb job with the questions. It went really well. And thanks to our participants. It's been great sort of hearing some of your questions, thoughts, insights, and we hope you'll join our upcoming webinar. So if you haven't already registered, you can find the link to that in the chat box. And just a quick reminder to, as Leah mentioned, to fill out our survey, and the open-ended questions on the slide are there. And if you have any questions, I know Leah and Catherine would be happy to connect with you, and they've included their emails on the slide deck for you to do so. So we really look forward to our upcoming webinars, and hope you'll join. And unless there's any final words from Leah or Catherine or Lisa or Hassan, I think we can close today's webinar.
Thank you very much. Yeah, thanks,
Thank you.
Thanks, everyone. Goodbye, and have a great day.